What is scoliosis treatment and why is it needed? For minor curves, the primary goal of treatment is to prevent them from getting worse or even to make them better. For major curves, the goal is to alleviate the effects of scoliosis and improve the deformity. Let us take a closer look at physical rehabilitation. Physical therapy has a long tradition in the treatment of scoliosis, especially in Germany. At the beginning of the 20th century, institutes were opened at various locations in Germany to improve the posture of hospitalized patients. Before the turn to the 20th century, scoliosis treatment included a variety of devices designed to flatten the rib hump or strengthen the trunk muscles. At the beginning of the 20th century, scoliosis was treated with methods such as club scrawling, while the introduction of the three-dimensional scoliosis treatment, according to Katharina Schroth, in 1921 marked the first time that the purely mechanical treatment approach was abandoned in favor of a more holistic approach. During the last century, several physiotherapeutic procedures for the treatment of scoliosis have been described, most of which are no longer taught and have almost all disappeared. What has been scientifically studied is the three-dimensional scoliosis treatment according to Katharina Schroth. In addition to this method of treatment, the Schroth Best Practice Program is known worldwide as a specific treatment measure, along with non-specific treatments such as yoga, Lobomate and SEAS. There are other methods of physiotherapeutic treatment practiced worldwide that are not supported by evidence. These general methods of physical therapy that have not been developed specifically for scoliosis should no longer be used. The effectiveness of intensive physical therapy has been described in several studies. From these studies, it can be concluded that scoliosis can be corrected by physical therapy in certain cases, and that the burden of bracing can be significantly reduced by accompanying physiotherapeutic treatment and support from a physiotherapist. Here on the left, you can see a female scoliosis patient with right thoracic scoliosis, a right-sided rib hump, the right-sided deviation in the thoracic region at rest. On the right you can see an exercise from the Schroth Best Practice Program. It is clear to see how the right-sided deviation is rebalanced and even the rib hump is reduced with the help of breathing during the exercise. Recent scientific findings on the correctability of scoliosis conclude that both the lateral deviation of the spine and the rotation of the spine can be reduced by a simple corrective movement. A reduction of the trunk deformity is possible by a simple increase of the lumbar lordosis, mainly at the level of the first lumbar vertebra, in combination with an increase of the rounding, we call it kyphosis, in the lower thoracic area. As a result, exercises to strengthen the lateral profile, we call the sagittal profile, have recently been integrated more and more into the Schroth concept. These exercises can be performed on wall bars or in a hallway. Here we can see the so-called catwalk, which allows a good mobilization with a relatively normal lateral profile if the lower costal arch can swing forward within the walking rhythm. In addition, simple treatment techniques such as 3D Made Easy have been developed as a precursor to the more complex corrective maneuvers of the Schroth technique. As shown in this illustration for a typical functional 3-curve pattern, this new treatment technique is applied according to the patient's individual curve pattern. This is the 4-step exercise sequence from the 3D Made Easy program for a functional 3-curve scoliosis. First, reverse the pelvic position. Second, correct the shoulder girdle. Third, inhale into the left thoracic region. And 4, stabilize. These new treatment methods are also being used in more modern and shorter rehabilitation concepts, which increasingly have to adapt to the fact that patients can no longer be absent from school for 6 weeks without risking a disadvantage. To exercise for 20 minutes a day is not enough to influence the course of scoliosis. Therefore, activities of daily living have gained importance. A full day of self-management is possible when scoliosis pattern-specific activities of daily living are incorporated into daily life. Wipe your neighbor off the table. This exercise from the Activities of Daily Living program allows the patient to fully correct her posture. The right hip can move up. The patient crosses her right leg over her left leg. Group therapy for scoliosis patients is particularly effective because it helps patients to feel less alone with their problems and provides an emotional outlet through shared experiences. Therefore, efforts are being made to implement a new concept of short-term rehabilitation of 5 days. More information can be found in the Scoliosis Guide for Patients and Families, shown here on the left, and in the Schroth Best Practice Academy textbook, shown on the right. You can download both books for free. Please use the attached QR code.